comes to first aid, one of the crucial things you need to know is soft tissue injuries. Why? Because they're the most common injuries with athletes and people of all ages. Whether your feet look like this, or maybe even this, there's always a chance you might get a soft tissue injury. But now, what exactly is a soft tissue injury? This includes injuries done to your muscles, ligaments, tendons, or nerves. The most common type of injuries are sprains, strains, carpal tunnel, and tendinitis. Now, just in case you were all wondering, here's a picture of all the ligaments in your foot. Common causes of these injuries are direct or indirect trauma from sports, falling, or overuse or repetition of a movement. As you probably have already guessed, athletes and laborers suffer from this the most. Now, what exactly is a sprain? You see, joints are held together and supported by tough bands of tissue called ligaments. When there's a small tear in a ligament and joint capsule, that is called a sprain. Sprains occur most commonly in the thumb, ankle, and wrist. Sprains are also known as that sore and tender injury in your muscle that puts you in a brace and lets you leave 5 minutes early from class. Strains are injuries done to your tendons, or the thing that connect your muscle to your joints. Common areas where you will strain muscles are the calf, the groin, and even the hamstring. Some symptoms of sprains or strains may include pain, swelling, stiffness, or that awful bruisey color on your skin. Hey, all you athletes, do you recognize this picture? Now, I know this is not a real foot, but this is what your foot will look like if you're experiencing pain. The reason why it's swelling up so much is because blood would be flowing to that area. Tendinitis is one of the most common injuries for athletes. The most common one would be Achilles tendinitis. As you can see, the Achilles tendon runs from the back of your leg all the way down to your ankle. This usually occurs when runners are not wearing proper shoes or are running across uneven terrain. Achilles tendinitis occurs when the tendon gets inflamed. When the tendon gets inflamed, you feel the pain. Unfortunately, there's poor blood flow into this area, which is why the healing process is very painful and very slow. Unfortunately, our tendons get weaker as we age. They become less flexible and they're more prone to injury. So, as you get older and periods of inactivity grow longer, it is best to stretch before you do any type of exercise. Another very common injury would be carpal tunnel syndrome. This is most common in adults because this is common in people who perform repetitive motions of the hand or the wrist. Typing on a computer keyboard is one of the biggest causes of carpal tunnel. There are other causes, of course, such as playing some musical instruments, using tools, painting, writing, sewing, assembly line work, and etc. Carpal tunnel syndrome is the pressure on a median nerve. The median nerve runs to the middle of your hand, and it supplies feeling and movement to the parts of your hand. If you have carpal tunnel, this leads to numbness, tingling, weakness, or muscle damage. Soft tissue injuries are graded according to their severity. Grade 1 means that some fibers in your tissue are torn, and the site is moderately painful and swollen, but however, your function and strength are still mostly unaffected. A grade 2 injury means that many fibers are torn, and you have a little bit loss of function and strength. A grade 3 injury means that your tissue is completely torn. You might need surgery to repair it. If you realize that someone has a soft tissue injury, the first thing you can do is RICE, and that is rest, ice, compression, and elevation. For the first 72 hours, there might be a lot of swelling and pain in that area, but slowly, anywhere from 48 hours to 6 weeks, the injury will heal. However, if you have really damaged your tissue, it might take 3 weeks to a year for the damaged tissue to be replaced and replicated. In the meantime, it would be very wise to visit an orthopedist. He might be able to give you protective footwear or a brace to help the healing process go smoothly. Now, if you're an athlete and you know you're prone to these type of injuries, it would be very wise to stretch a lot before any game. Now, unfortunately, if your injury is very severe and you do need surgery, it would be very wise to also go through physical therapy afterwards to make sure that your foot is back to normal as soon as possible. So make sure that you stretch and definitely warm up, especially if you don't want to end every single practice like this. So do yourselves a favor. Prevent soft tissue injuries from occurring by stretching and wearing proper footwear at all times. These injuries occur the quickest and heal the slowest.